Good morning, Mr. Chairman, members of the committee. My name is John Ayoub, and I'm proud to lead the team at Mobridge Regional Hospital and clinics in Mobridge, South Dakota. I'm here this morning in support of Senate Bill 154 and the important protections that it offers for rural hospitals throughout the state. The 340B program was opened to critical access hospitals like ours in 2010. One of the major intents of the program is to ensure that safety net providers like us, known as covered entities, are able to recoup pharmaceutical savings through retail pharmacies funded by manufacturers and not the federal or state government, to ensure that we are able to provide patient care services that are needed but not affordable without these additional resources. For those of you not familiar with Mobridge Regional, we are a 25-bed facility and the only hospital in the state designated as a Level 4 trauma center in both North and South Dakota. We are the only hospital providing obstetrical services and delivering babies, as well as the only hospital providing general and trauma surgery services in at least a 100-mile radius in every direction. We operate 4 rural health clinics, including one in Mobridge and one in Selby. We have one in McLaughlin within the Standing Rock Sioux Tribe Reservation and another clinic in Timber Lake within the Cheyenne River Sioux Tribe Reservation. We own and we operate a rural ambulance service to provide both basic and advanced life support, 911 response, and emergency transport services for patients. We care for communities in most or all of 5 counties and have a geographic footprint the same size as the state of New Jersey. Our service area is below both the median state and national income levels, and 2 of the counties we serve are perennially listed as 2 of the poorest counties in the entire country. Last year, we saw 5,000 patients come through our emergency room. That number is more than the combined population of every man, woman, and child living in the cities where we have clinics. Why do I tell you this? Because 340B helps to pay for it. Our rural ambulance service, between 911 calls and emergency interfacility transports, cared for over 1,000 patients last year. Nearly 100 of them were traumatic in nature. Why am I telling you this? Because 340B helps to pay for it. On average, we deliver 70 babies a year. More than a quarter of them are delivered via emergency cesarean section, and around a third of the mothers who have babies at our hospital test positive for methamphetamine. We need to maintain surgeons, a surgical team including anesthesia, and nursing services available 24/7, 365. Why am I telling you this? Because 340B helps to pay for all of it. Our participation in the 340B program and our relationship with our 2 contract pharmacies allowed us to provide these services to the communities we serve, which save and improve lives on a daily basis. In mid-2020, several pharmaceutical manufacturers began restricting the distribution of 340B priced drugs to contract pharmacies, severely impacting our participation in the program by restricting us from 2 to a single contract pharmacy. Over the course of the next couple of years, dozens of additional pharmaceutical manufacturers took the same tact, effectively ensuring that the benefit of the 340B program to Mobridge Regional Hospital was cut in half. As the number of pharmaceutical companies restricting access to the programs continues to grow, our ability to provide life-saving services continues to be eroded. We lose money on nearly 80% of the patients that we care for. It is our mission to serve them, and we will continue to do so, but we have to remain open in order to do that. As an organization, we lost around $600,000 last year and just over $1 million the year before. If we are not open to serve our patients, residents, and community, or if we need to shut down one of these life-saving services in order to keep the rest of the organization financially viable, people will die. This is not hyperbole or an exaggeration to make a point. It is a fact. We are the only facility providing emergent life-saving surgery and delivering babies between Bismarck and Pierre, between Aberdeen and the Rapid City area. There is no one else capable of providing these services, and nobody is lining up to do it should we falter or fail financially. Thank you so much for your time and attention this morning. I ask for your concerted consideration of Senate Bill 154 and its ability to help us continue to save and improve lives. This concludes my testimony, and I will stand by to answer any questions you may have.
Ladies and gentlemen, I want to start off being very clear that the Hospital Association is very supportive of this bill to keep South Dakota rural pharmacies open and support rural hospitals. Over the last several days, you've been hearing many different ideas from out-of-state opponents throwing dust in the air to confuse you about this issue. This issue is very simple. This bill stops Big Pharma from discriminating against South Dakota community pharmacies. Full stop. First, I want to level set on what your nonprofit community hospitals do for you in this state. Last year, they gave over $137 million of charity care and bad debt away. We also were faced with a $73 million gap between what Medicaid pays and what our actual costs are. 20% of our nonprofit 20% of our nonprofit hospitals today operate in the red, as Mr. Ayoub just expressed. Historically, hospitals make a 0 to 3% margin. Just one of the top 10 big pharma companies made $4.4 billion in profit. That wasn't last year, that was last quarter. And they weren't number one. In 2022, 340B discount accounted for only 3% of big pharma revenue. Excuse me, that feels like a relatively small program compared to the huge benefits it provides to South Dakotans. Let's talk about transparency, because I'm sure you've heard that a lot over the last several days. The federal program must vet hospitals to even participate in the 340B program. Let's talk about auditing. Hospitals that do participate in 340B are audited by HRSA, which is the federal oversight arm, and we are audited, and I want you to listen to this, 40 times more than Big Pharma. 40 times more we're audited than Big Pharma. As testified by Mr. Ayoub, these savings provide real services to real South Dakotans. The transparency argument is just a red herring to scare you and bring dust and confusion into this discussion. Finally, the last thing you need to know about transparency is to look across our state and see where those dollars go and how they provide access to care for you and your families. It's important for you all to remember that any dollar that goes above margin from a nonprofit hospital goes to three places: their community, their employees, or infrastructure. Not one of us wants our family members to go to a broken down facility with equipment that doesn't work when we're talking about trying to save their lives. Fact of the matter is, South Dakota nonprofit hospitals invest in South Dakota communities. The same cannot be said of Big Pharma. Another important point, Big Pharma is not, and I cannot emphasize this enough, not mandated to participate in the 340B program. They do it because they get access to Medicare and Medicaid formularies. If they weren't making a profit, I assure you, they would not be participating in the program. Another point I cannot stress enough, and this is really important, this program does not use taxpayer dollars. You're also going to hear about the federal government needs to fix this problem. The problem is they're not. And as was testified earlier, 29 states have done this or are in the process of doing exactly what we're trying to do here today until Congress can get their act together and fix the problem. Apparently, we have to do it at a state-by-state level. This has been tested in court twice in the 8th Circuit, that is our circuit, and upheld both times, and the Supreme Court refuses to take up the case. You're also going to hear or have heard them talk about the Deceptive Practice Act. This bill needs teeth because we cannot afford to go toe-to-toe with Big Pharma in court where they could bleed us dry with their, and I quote, $112 billion of profit from 2 years ago. And they're going to win in the end either way. The Deceptive Practice Act gives the Attorney General the latitude to provide injunctive relief. They're not going to be throwing Big Pharma CEOs in jail in South Dakota. In closing, you may have seen a recent news article that stated fixing the problem is a no-brainer. I agree. This bill helps fix the problem. It helps to stop Big Pharma from discriminating against our South Dakota community pharmacies. Ladies and gentlemen, I will conclude my remarks. I will stand down and stand by for questions. Thank you, Mr. Chair.